41. What is bronchiolitis caused by? A. Either infection or allergy. B. Mycobacterium tuberculosis. C. The respiratory syncytial virus. D. An exacerbation of asthma.
Answer: C.
Rationale: the respiratory syncytial virus, which causes only mild upper respiratory infections in older persons, causes bronchiolitis, a serious respiratory infection, in infants and young children. Answer questions 42 to 44 on the basis of the following information. Your patient is a 30-year-old female who is complaining of a generalized rash and dyspnea after eating shellfish. The patient has small itchy, red welts all over her body and says her tongue feels like it is swollen. She complains of difficulty moving air in and difficulty catching a full breath. This patient's vital signs show a blood pressure of 110/60, a pulse of 100, strong and regular, and a respiratory rate of 36. Her breathing is somewhat shallow and labored. 42. This patient is exhibiting the signs and symptoms of A. An allergic reaction. B. A partial airway obstruction. C. Anaphylactic shock. D. Epiglottitis or croup.
Answer: A.
Rationale: this patient's blood pressure is still compensating for the allergic reaction. Therefore, the patient is not in anaphylactic shock. 43. Medications used to treat this patient may include which of the following? A. Isoproterenol. B. Haloperidol. C. Hydroxyzine. D. Dopamine. Answer: C. Rationale: isoprel, haldol, and dopamine are not indicated for this patient. Hydroxyzine is an antihistamine that can be used to treat the pruritus, itchy red welts. 44. This patient needs close monitoring because she could progress into which of the following conditions? A. Bradycardia. B. Complete airway obstruction. C. Anaphylactic shock. D. Respiratory distress. Answer: C. Rationale: this patient needs to be monitored for possible anaphylactic shock. 25. After placing an endotracheal tube, you note that breath sounds are much stronger on the right side of the chest than on the left. What does this suggest? A. The ET tube has been inserted into the right mainstem bronchus. B. The patient has developed a pneumothorax on the right side. C. The ET tube has not been inserted far enough into the trachea. D. The patient has probably aspirated vomitus into the trachea. Answer: A. Rationale: if breath sounds are stronger on one side than on the other, or absent on one side, this suggests that the tube has been inserted too far and is resting in one bronchus. 26. You have just delivered a baby girl. Evaluation reveals that the infant cries loudly and has a heart rate of 140. Her body is pink but the extremities are blue, and she is actively moving all extremities. Her APGAR score is A. 7, B. 8,
C. 9, D. 10.
Answer: C. Rationale: with the exception of the blue extremities, the infant scores a 2 on activity, pulse, grimace, and respirations. Her appearance scores as a 1. 47. Causes of third trimester bleeding include A. Ectopic pregnancy, preeclampsia, uterine rupture. B. Eclampsia, spontaneous abortion, placenta previa. C. Ectopic pregnancy, uterine rupture, pelvic inflammatory disease. D. Abruptio placentae, placenta previa, uterine rupture.
Answer: D. Rationale: a ruptured ectopic pregnancy usually occurs within the first trimester. Eclampsia and PID are not associated with bleeding.
48. What is an assessment finding of pulsus paradoxus associated with? A. Emphysema. B. Congestive heart disease. C. COPD. D. Myocardial infarction.
Answer: C. Rationale: pulsus paradoxus, or a drop in blood pressure with each respiratory cycle, is associated with chronic obstructive pulmonary disease, COPD. 49. The term tracheal tugging refers to which of the following? A. The use of accessory muscles during respiration. B. Retraction of intercostal muscles during inspiration. C. Cyanosis and nasal flaring with exhalation. D. Retraction of neck tissues during respiration. Answer: D. Rationale: Tracheal tugging refers to retraction of neck tissues during respiratory effort. 50. A dull sound heard during chest percussion may be associated with which condition? A. Pneumothorax. B. Emphysema. C. Pneumonia. D. Bronchitis. Answer C. Rationale. A dull sound on chest percussion may be associated with pneumonia, hemothorax, or pulmonary edema. 51. Pulse oximetry allows you to continuously record which of the following? A. Pulse rate and oxygen saturation. B. Respiratory rate and oxygen saturation. C. Pulse rate and hemoglobin level. D. Respiratory rate and hemoglobin level. Answer A. Rationale. Once it is attached to the patient's finger, the pulse oximeter will continuously record the pulse rate and oxygen saturation level. 52. Your patient is a 66-year-old man who is extremely thin but has a noticeably distorted barrel-shaped chest. He reports a history of dyspnea that has recently gotten worse. You note that he purses his lips when breathing, but hypoxia is not apparent. In addition to monitoring vital signs, breath sounds, and ECG, starting in 4 and transporting the patient, what other treatment should you give to this patient? A. Administer high-flow oxygen via BVM ventilation. B. Administer low-flow oxygen and a bronchodilator. C. Administer oxygen via non-rebreather mask and furosemide. D. Orally intubate the patient and assist ventilations. Answer B. Rationale. The patient is showing signs and symptoms of emphysema. Administer low-flow oxygen to preserve his hypoxic drive. 53. A 28-year-old woman is complaining of a sudden onset of severe abdominal pain that radiates to her shoulder. Her BP equals 88/60ths, P equals 110, and R equals 20. Her skin is cool, pale, and clammy. She states that her last normal menstrual period was 6 to 8 weeks ago. Which of the following conditions best describes the patient presentation? A. Uterine rupture. B. Ectopic pregnancy. C. Abruptio placentae. D. Perforated uterus. Answer B. Rationale. A sudden rupture of an ectopic pregnancy would result in a loss of blood that would place the patient in compensatory shock. 54. What respiratory pattern is characteristic of Kussmaul's respiration? A. An increase in both rate and depth. B. An increase in respiratory rate only. C. A decrease in both rate and depth. D. Decrease in respiratory rate only. Answer A. Rationale. Kussmaul's respirations, which are associated with diabetic ketoacidosis, are characterized by increased rate and depth of respirations. 55. Which of the following factors increases the amount of energy necessary for the patient to expend for respiration? A. Loss of pulmonary surfactant. B. Decrease in airway resistance. C. Increase in pulmonary compliance. D. A decrease in body temperature. Answer A. Rationale. Loss of pulmonary surfactant, which can occur in pneumonia and other conditions, increases the tendency of the alveoli to collapse and thus increases the work necessary for respiration. 56. What does it mean if the pH of normal urine is 6.0 and the pH of distilled water is 7.0? A. Urine is twice as acidic as distilled water. B. Urine is 10 times as acidic as distilled water. C. Urine is twice as alkaline as distilled water. D. Urine is 10 times as alkaline as distilled water. Answer B. Rationale. Hydrogen ion concentration, or pH, is measured on a scale of 1, highly acidic, to 14, highly alkaline, with 7 being neutral. For each unit on the scale, the solution is 10 times more acidic or alkaline. These measurements are very important in the consideration of the oxygen diffusing capacity of the blood, where very small changes in pH are highly significant. 57. Your patient is a 6-year-old child who is conscious but not breathing because of an airway obstruction. What is the first thing you should do for this patient? A. Give 5 back blows followed by 5 chest thrusts. B. Visualize the airway and perform a finger sweep. C. Perform subdiaphragmatic abdominal thrusts. D. Open the airway with a head tilt/chin lift. Answer C. Rationale. The first step in treating a conscious child of this age with a complete airway obstruction is to perform the Heimlich maneuver, i.e., subdiaphragmatic abdominal thrusts. Continue until the obstruction is relieved or the child becomes unconscious. 58. You should attempt to remove foreign material from a patient's airway with forceps only in what situation? A. You do not have access to laryngoscopy equipment. B. You have tried but failed to suction the airway. C. You are unable to insert an endotracheal tube. D. You are able to visualize the obstruction directly. Answer D. Rationale. To prevent tissue damage, you should attempt to physically remove foreign material only if you can actually see the obstruction with a laryngoscope. Answer questions 59 to 63 on the basis of the following information. Your patient is a 29-year-old female complaining of the sudden onset of severe shortness of breath and chest pain. She indicates that she is recovering from surgery to her left femur after an automobile crash. 59. Your patient is a 29-year-old female complaining of the sudden onset of severe shortness of breath and chest pain. She indicates that she is recovering from surgery to her left femur after an automobile crash. A. Medication reaction. B. Myocardial infarction. C. Pneumothorax. D. Pulmonary embolism. Answer D. Rationale. This patient has symptoms of a pulmonary embolism. 60. You would expect to find which of the following in this patient? A. Tracheal deviation. B. Bradycardia. C. Pulsus paradoxus. D. Bradypnea. Answer B. Rationale. You would expect to see this patient in tachycardia rather than bradycardia due to the increasing dyspnea and hypoxia resulting from the pulmonary embolism.